Hi friends, welcome to my channel Vasu Medical Diary. Today we are going to see NABH 5th edition 4th chapter, that is PRE, Patient Rights and Education. In this chapter we have 8 standards and 51 objective elements. Standard number 1. The organization protects and promotes patient and family rights and informs them about their responsibilities during care. In that, objective elements are: patient and family rights and responsibilities are documented, displayed, and they are made aware of the same. Whenever the patient is getting admitted, with the general consent itself will be explaining them about their responsibilities and rights. It will be documented and also it will be displayed in the wall of the hospital. Patient and family rights and responsibilities are actively promoted by the hospital staffs. The organization protects patient and family rights, and the organization has a mechanism to report a violation of patient and family rights. Violation of a patient and family rights are monitored, analyzed, and corrective preventive action taken by the top leadership of the organization. Standard 2. Patient and family rights support individual beliefs, values, and involve the patients and family in decision-making process. In that, objective elements are: patient and family rights, including respecting values and beliefs and any special preferences, cultural needs, and responding to requests for spiritual needs, should be adhered to. Patient and family rights, including respect for personal dignity and privacy during examination, procedures, and treatment must be followed. Patient and family rights include protection from neglect or abuse. So all the patients are having the rights to protect themselves from neglect and abuse. And patient and family rights include treating patient information as confidential. You might have seen in the lift and all, there will be a writing saying that don't discuss about the patient condition inside the lift or in the pantry. So and so writings are to prevent breaching of the patient confidentiality. Patient and family rights include the refusal of treatment. Patient and family rights includes a right to seek an additional opinion regarding the clinical care. So they are having a right to go for a second opinion. Patient and family rights include informed consent before the transfusion of blood and blood components, anesthesia, surgery, initiation of any research protocol, or any other invasive high-risk procedures or treatment. So during all these procedure and all these event, definitely we have to go for informed consent with the patient. Patient and family rights include a right to complain and information on how to voice a complaint. While admission itself, you have to tell the patient how to voice out their complaints and their concerns, where to raise. All those things we have to inform to the patient. Patient and family rights include information on the expected cost of the treatment. On admission itself, we have to give estimated cost to the patient. Patient and family rights includes access to their clinical records. Patient and family rights includes information on the name of the treating doctor, care plan, progress, and information on their healthcare needs. Patient rights include determining what information regarding their care would be provided to self and the family. So still the patient is having the rights to decide which all the information can be shared with the family. Standard number 3. The patient and our family members are educated to make informed decisions and are involved in the care planning and delivery process. Objective elements. The patient and our family members are explained about the proposed care, including the risk, alternatives, and benefits. Whatever we have decided, maybe a medical management or maybe a surgical management, we have to inform to the patient about the risk-benefit ratio. What is the particular risk when they are undergoing medical management or surgical management? What would be the outcome? All risk and benefits, everything we have to discuss with the patient. The patient and family members are explained about the expected results. While providing a treatment, you should inform them what is the expected outcome. it should be a transparent discussion. The patient or family members are explained about the possible complications. So, while undergoing any treatment, we should clearly tell them what all the possible complications may happen. The care plan is prepared and modified in consultation with the patient and or family members. For example, you are receiving a patient with such and such complaints and you are planning a treatment plan. If the particular family is not okay with that, if they want to change the treatment plan, with their discussion, you have to change those treatment plan. It is their rights. The patient and our family members are informed about the results of diagnostic tests and the diagnosis. Whatever test, blood test may be, radiological test, any diagnosis, whatever you are having, you should inform to the family members then and there. The patient and family members are explained about any change in the patient's condition in a timely manner. This is very, very important. For example, you are admitting a patient under medical management in a ward, but the patient is sick, suddenly sick, early warning score is showing very high. You are urgently shifting the patient to ICU. Even though the bystander is not in the hospital, you should call them, update them there is a change in the patient condition. The patient and our family members are provided multidisciplinary counseling when appropriate. For example, if the patient is not at all prognosing very good with the treatment, in that case, you have to conduct a multidisciplinary meeting with all like doctors, one from operations, one from nursings, and from doctor side, GPs. Everybody should sit together with the patient. We have to talk about the clinical outcome of the patient and the present condition, everything. You have to document this. This is called multidisciplinary meeting. Standard 4. Informed consent is obtained from the patient or family member about their care. The organization obtains informed consent from the patient or family for situations where informed consent is required. We already discussed in what are all the situation informed consent is required. So during all those period, we have to take an informed consent. Informed consent process adheres to the statutory norms. For example, while taking consent, it should be in bilingual manner. It should be in bilingual, and you should explain properly. Their risk and benefit ratio should be discussed. All those things will come as statutory norms. And there should be a witness. Only a surgeon should explain for surgery. All those things are the statutory norms of informed consent. We have to follow all those rules. An informed consent includes information regarding the procedure, its risk, benefit, alternatives, and to who will perform the procedure in language that they can understand. As I told earlier, we have to explain everything in their mother language in a clearly understandable manner. Simple language we have to talk with them. We should not talk too much of medical terms and confuse them. The organization describes who can give consent when a patient is incapable of independent decision making and implements the same. We should have a policy if at all the patient is unconscious or incapable of making any decision. We should have a policy who can sign for them, and we have to implement the same. Informed consent is taken by the person performing the procedure. Always the informed consent should be explained by the surgeon or anybody who is doing the procedure, and they have to take informed consent. And the standard number 6, patient and families have a right to information on expected cost. So the patient or family members are made aware of the pricing policy in different settings like OP, emergency, ICU, and inpatients. The relevant tariff list is available to the patient in wherever it is applicable. The patient or family members are explained about the expected cost. The patient and family are informed about the financial implications when there is a change in the care plan. So as we discussed earlier, if any change in the patient condition and the patient care plan, we have to discuss with the family and inform this prior to the family. Standard number 7, the organization has a mechanism to capture patients' feedback and to redress complaints. The organization has a mechanism to capture feedback from patients, which includes patient satisfaction. So, ongoing daily basis, someone should go to the patient, attend them, and ask them if they are happy with us. Is there any complaints? Everything we have to. It should be ongoing as well as after the discharge. The organization has a mechanism to capture the patient experience. Maybe after the discharge, we can send a text message to the patient with any link, which will guide them to separate page for feedback. They can give their valuable feedback over there. We can have any system like that. The organization redress the patient's complaint as per the defined mechanism. The complaint redressal, which means once the complaint is lodged by the patient, someone should be there to monitor the complaint. They have to go talk to the patient and solve the complaints. And next, patient and family members are made aware of the procedure for giving feedback and lodging complaints. When they are getting admitted itself, we have to go talk to them, give explanation about how to lodge the complaint, how they can raise concerns, everything. Feedback and complaints are reviewed and are analyzed with a defined time frame. So maybe every week, the quality manager or the patient experience team should sit and review all the complaints, and they have to close the complaints with definite time frame. There should be a separate tab for closing all the complaints. And corrective and preventive actions are taken based on the analysis. So after this, we have to take corrective and preventive action wherever it is applicable and appropriate. Standard number 8. The organization has a system for effective communication with patients and our families. The communication with the patient or families is done effectively, and the organization shall identify special situations where enhanced communication with patients and their families would be required. Enhanced communication in the sense, you will have, for example, the multidisciplinary meeting was the enhanced communication. Wherever the situation is required, we have to make enhanced communication and document it for the safer side of the institution. Enhanced communication with the patients and their family is done effectively. The organization ensures that there is no unacceptable communication. And the organization has a system to monitor and review the implementation of the effective communication. Effective communication, whenever we are giving any health education to the patient, we will be monitoring in the nurse's chart as well. Whenever we give some particular demonstration, we have to make them to redo it and document in some patient records, so that we have a proof that we are teaching them everything. All those things should be effectively done and documented as well. Thank you. End of chapter 4. We'll meet in chapter 5, which is HIC, Hospital Infection Control.